This is the culture shift that we all need, and we all need to be there to protect the integrity of online health information. But if that's not reason enough, I'm going to tell you about 5 benefits to using social media as a health professional. Hey guys, welcome back to my channel. Before we get started, please don't forget to subscribe and let me know in the comment section below if you've ever faced any issues with social media as a healthcare professional. As the first Chief Medical Social Media Officer at a large academic medical center, I've been speaking about why it's important for doctors and all health professionals alike to get on social media, to lend their expertise, and to protect the integrity of online health information. So as a physician, I've always felt very strongly about online health misinformation, and I've been encouraging physicians and health professionals to get on social media, to lend their expertise, and contribute to the online conversation. Some of you might be wondering how I got into this social media role in the first place. I will start by saying that I am not the first person on Twitter, on any social media platform, who is a physician to use social media. There are many greats who I know personally who have been using social media for years productively. So what started it all was really this passion for understanding how the general public receives their health information. So I'll take you back to my residency training years when I spent a couple weeks at ABC News trying to learn how the general public receives their health information through media, and how journal publications are vetted by news networks before making their way onto the evening news. During that time, I was exposed to weekly Twitter chats about various health topics, and that's when I realized that important organizations and thought leaders were constantly engaged in online conversation on social media and participating in various healthcare social media chats. I was then appointed onto numerous committees, basically anything related to PR or communications for all the major GI societies. And I also tried to start a Division GI account. In that process, I learned a lot about the do's and don'ts. Then I began doing research using Twitter data along with my mentor, Dr. Walter Chan, and we ended up presenting numerous abstracts and published in peer-reviewed journals about the subject of social media and gastroenterology. So long story short, fast forward a couple years and here I am today. So in any case, I spent enough time about that. Let's talk about the 5 benefits of using social media if you are a health professional. Number 1, engaging in that online conversation. So this is directly related to that whole idea of health misinformation, because a lot of the dialogue online may not be including trained individuals who are qualified to talk about those subjects. So as a result, there can be a lot of inaccurate information that's perpetuated, and without the presence of trained individuals in that conversation, the dialogue can be dominated by people who may not have the proper credentials to talk about those subjects. Now that's not to say that 100% of the time the information coming from trained health professionals is always accurate, but we have this added filter of training and credentialing, and hopefully these professionals are backing up what they're saying with good quality evidence-based medicine published in peer-reviewed journals. Number 2, staying up to date with medical information. All major societies, journals, organizations are now on social media, and it's a great way to get updates in real time whenever they come out. So gone are the days where you're getting the journal in the mail and then flipping through the table of contents. If you think about it, if something is happening around the corner, you're more likely to hear about it on social media before it even shows up on the evening news. So likewise with medical information, it's best to get this information now in real time through social media. Number 3, networking. So in recent years, there have been more health professionals on social media. Now more than ever, you have access to these individuals and you can start engaging with them in dialogue online and networking with them. In my own social media use, I've been able to meet physicians from all specialties across the country, around the world, and I don't think I would have ever been able to do that if it weren't for social media. Number 4, marketing. A lot of you might already think about marketing when thinking about social media, but what I mean is not just promoting your practice, but also using social media to educate the general public, with your patients, which could potentially help health outcomes. Also educating trainees and students who may otherwise not gain exposure to what you do. For instance, in gastroenterology, I'm an advanced endoscopist, so I don't deal as much with general GI and colonoscopies. So I'd like trainees and students to see that other side of gastroenterology if that's potentially something that they might be interested in. And also along the lines of marketing, not only can you recruit patients into your practice, but also recruit patients into clinical trials, invite them and keep them up to speed of events, symposiums, webinars that your practice or your center might be having. Number 5, taking control of your digital narrative. So if you're a health professional, chances are if I Googled your name, I would come across some rating websites or testimonials, but we can't always let that information, which may or may not be accurate, guide public perception of you as a health professional. So by adding your own voice into the mix with your website and your active social media presence, you could potentially change your digital image. So I hope you guys enjoyed this 30,000 foot view of the benefits of social media and why it's important for doctors and health professionals alike to be on social media to protect online health information. I will also mention that we are in the process of starting the first professional society to function like any other medical society devoted to health professional use of social media, and it's called the Association for Healthcare Social Media, so stay tuned for more about that. So as usual, if you enjoyed this video, please give it a thumbs up. Don't forget to subscribe, follow me on all my social media channels at Austin Chang MD, and check out my website, austinchang.com. So until next time, stay healthy, and I'll catch you in my next video. Bye!